This is what most rehab misses. Now, if you are someone who is either currently going to physical therapy for low back pain, stiffness, or tightness, or pain, or if you're somebody who has been to physical therapy and their back pain or their back stiffness really didn't get help, this is potentially why, especially if you're an endurance athlete. As athletes, we have a much higher level of tolerance, or we need to have a much higher level of tolerance to stress, to forces, to activity compared to the regular population. In addition, the way that the current medical system is built, insurance is only going to pay for so much. If you're at this current level, or this is where you get out of pain, insurance is only going to help you bring you up to that or slightly above that. It's not going to help you bring you to 100%, unfortunately. We need to make sure that we're building capacity to activity, not just focusing on the symptoms like most practitioners will get you to. We need to be able to tolerate the loads, the stresses, the forces, the duration of the activity we plan on doing once we graduate from rehab. Additionally, we need to have movement confidence. One of the big things that I see pop up is whether they're on the treadmill, whether they're outside, they don't feel confident doing certain things. They don't feel confident with speed work. They don't feel confident with going up and downhill. They don't feel confident with doing more individualized skills that are specific to the sport that they love to do. And not only is that going to hinder your performance overall, but it's still an increased risk for injury for you, whether that's a re-injury of what you had already or a new injury that could pop up down the road. And one other thing is that we don't necessarily have progressive exposure in the insurance model of physical therapy right now. Yes, some people will change your program periodically, but is it enough to hit the capacity, the intensity, the volume, the duration of the works that you do on a regular daily, weekly basis? And usually it's not. So we want to make sure that we're getting progressive overload of your workouts as your performance, because if we get back to our sport, we get back to training, we get back to competing, and we're not at that level where we should be, or we're not stronger than we should be, because where we were at before we got hurt, we were not strong enough to begin with. We need to go far and above of where we were to make sure we're nice, solid, stable, secure, so we don't have to worry about this back tightness, this back stiffness coming back. And we want to make sure that overall we're a better overall athlete. If you have any questions about this, if this hits you hard, put a fire emoji down in the comment. Put down your questions and concerns that you have for me, especially about your current rehab if you're going through it right now. Make sure you like and follow. Share this out to your friends that are dealing with low back pain and stiffness. And see you guys in the next